Dan dengan ini,
perkenalkan kami
Himpunan Mahasiswa Prodi Sarjana Terapan Keperawatan Malang
dan Profesi Nurse.
Selamat datang di Himpunan Mahasiswa Prodi Sarjana Terapan Keperawatan Malang dan Profesi Nurse Politeknik Kesehatan Kemenkes Malang. Himpunan Mahasiswa Prodi Sarjana Terapan Keperawatan Malang dan Profesi Nurse Politeknik Kesehatan Kemenkes Malang adalah organisasi mahasiswa tingkat prodi yang berperan sebagai media bagi anggotanya untuk mengembangkan pola pikir, kompetensi, dan kepribadian yang berkaitan dengan disiplin ilmu. Himpunan Mahasiswa Prodi Sarjana Terapan dan Profesi Nurse Politekes Kemenkes Malang tahun 2001 hingga 2022 memiliki beberapa visi dan misi sebagai berikut. Visi menjadikan HMP Sarjana Terapan Keperawatan Malang dan Profesi Nurse sebagai poros pergerakan dan pengembangan kemahasiswaan demi mewujudkan mahasiswa keperawatan yang berdaya saing profesional, berkarakter, berakhlak mulia, serta berprestasi. Misi pertama, membangun tata kelola HMP Sarjana Terapan Keperawatan Malang dan Profesi Nurse yang profesional berlandaskan iman dan takwa. 2. Mengoptimalkan pengelolaan pengembangan kompetensi, minat, dan bakat mahasiswa melalui kegiatan-kegiatan yang dapat mendukung tercapainya mahasiswa perawatan yang berkompeten. 3. Mengoptimalkan fungsi koordinasi dan advokasi kemahasiswaan dalam simpul kolaborasi. 4. Menyelenggarakan kegiatan kemahasiswaan yang efektif dan efisien sekaligus menjadi instrumen dalam mengakomodasi gagasan mahasiswa. Himpunan Mahasiswa Prodi Sarjana Terapan Keperawatan Malang dan Profesi Nurse juga memiliki beberapa program kerja sebagai berikut. Smart Perennial Aiming Nursing Event, Lomba Keilmiahan, Rapping Day, Diskusi Ilmiah, Basic Trauma Cardiac Life Support, Kuliah Tamu, Opsama, Bedah Buku, Pengakmas, Danusan, Safari Duafa, Halal Bihalal, Sarasehan, Pemuda Peduli Sesama, Kajian Islam Rutinan. Selamat datang di Kampus Politeknik Kesehatan Kemenkes Malang, Polkesma. Perguruan Tinggi Kesehatan di bawah naungan Kementerian Kesehatan Republik Indonesia. Kampus utama Polkesma berlokasi di Jalan Besar Ijen Malang. Kampus yang berdiri mulai tahun 2001 ini merupakan salah satu dari 38 institusi pendidikan kesehatan yang dimiliki Kementerian Kesehatan. Dalam perjalanannya, Polkesma memiliki visi menjadi politeknik kesehatan yang beradab dan berdaya saing global, serta terdapat sejumlah misi yang diemban, antara lain menyelenggarakan pendidikan dan pembelajaran yang berkualitas untuk mengembangkan potensi dan kepribadian mahasiswa yang beradab dan berdaya saing global. Kemudian menyelenggarakan penelitian terapan dan pengabdian kepada masyarakat yang berkualitas dan inovatif. Selain itu, melaksanakan tata kelola organisasi yang baik berbasis teknologi informasi. Dan yang terakhir, mengembangkan kerjasama kemitraan dalam negeri maupun luar negeri. Polkesma memiliki 5.000 mahasiswa. Kampus yang menjadi barometer pendidikan kesehatan di Indonesia ini membawai 7 kampus yang tersebar di Malang, Jember, Blitar, Kediri, Trenggalek, Ponorogo, dan Lawang. Dari semua kampus tersebut terdapat 20 program studi. Polkesma telah berhasil meraih akreditasi baik dan termasuk dalam kualifikasi 1 Politeknik Kesehatan di Indonesia. Pencapaian tersebut merupakan gambaran penerapan sistem manajemen mutu tata kelola institusi dan strategi pembelajaran inovatif, serta pemanfaatan teknologi informasi yang terus berkembang.
Salam sehat, sehat tanpa korupsi. Saya, Budi Susatya, Direktur Poltekkes Kemenkes Malang. Tahun 2021, Poltekkes Kemenkes Malang menjadi salah satu Satker UPT Kemenkes yang diusulkan menjadi Satker wilayah bebas dari korupsi tingkat nasional. Zona integritas dibangun dalam upaya mewujudkan tata kelola perguruan tinggi yang baik dan bersih menuju wilayah bebas dari korupsi dan wilayah birokrasi bersih melayani. Dengan semangat yang tinggi, Poltekkes Kemenkes Malang berkomitmen menuju wilayah bebas dari korupsi tingkat nasional untuk mewujudkan perguruan tinggi yang bersih, melayani, profesional, efektif dan efisien, dengan harapan agar seluruh layanan di Poltekkes Kemenkes Malang menjadi layanan yang semakin bermutu dan berkualitas, terwujud budaya integritas.
Komitmen bersama dilaksanakan untuk menuju zona integritas wilayah bebas dari korupsi yang dicanangkan Kementerian Pendayagunaan Aparatur Negara dan Reformasi Birokrasi. Fakta integritas menjadi pegangan untuk berbenah. Perubahan positif berkelanjutan terus dilakukan di seluruh tingkat manajemen, perbaikan fasilitas maupun sistem pembelajaran. Untuk memacu kinerja pegawai, sistem reward and punishment diberlakukan. Menuju pelayanan prima, Polkesma terus memperbaiki sistem layanan, baik konvensional maupun sistem digital berbasis teknologi informasi. Ruang layanan akademik menjadi sentra pelayanan terhadap mahasiswa maupun alumni. Sikap ramah, santun, dan solutif menjadi budaya oleh setiap pegawai Polkesma dalam memberikan pelayanan. Untuk mendukung peningkatan kualitas pelayanan, disiapkan perangkat digital yang mengatur antrian. Tak hanya itu, untuk mengawasi pelayanan agar berjalan semestinya dan menghindarkan dari praktek korupsi, kolusi, dan nepotisme, Satgas Pengawasan Internal selalu siap memantau di semua sektor pelayanan. Untuk memberi kemudahan terhadap mahasiswa, serta mengurangi interaksi antara mahasiswa dan pegawai yang berpotensi menimbulkan praktek kecurangan, manajemen membuat sejumlah aplikasi digital termasuk dalam hal pembayaran. Masing-masing mahasiswa diberikan akun virtual untuk menyelesaikan segala tanggungannya.
Oleh pihak kampus kita sangat dimudahkan untuk pengurusan administrasi tersebut, dan salah satunya juga adalah pembayaran SPP. Untuk pembayaran SPP kita bisa melalui virtual account jika kita memiliki, dan mungkin salah satunya juga kita bisa melalui ATM, langsung ke ATM seperti itu. Jadi tidak perlu datang jauh-jauh ke kampus.
Dalam bidang pelayanan administrasi, Polkesma juga telah menerapkan sistem digital. Sistem ini berlaku untuk pegawai internal maupun terhadap mahasiswa atau alumni dan masyarakat luas. Diwadahi dalam website poltekkesmalang.ac.id, segala alur layanan administrasi dapat diakses, seperti legalisir online, pengajuan SK online, hingga pengaduan gratifikasi secara online. Peningkatan fasilitas guna memberikan rasa nyaman terhadap mahasiswa terus dilakukan.
Okay, before the International Just Lecture of Nursing Study Program will be held, I will explain about Standard Operating Procedure International Just Lecture of Nursing Study Program Malang. For the first, each participant must follow the activity from beginning to the end and fill in the initial and final attendance. Second, format the Zoom name is into the class _absent_name. If it does not match the format, participants are not allowed to enter to Zoom. Third, it is suggested to the International Just Lecture participant of the Bachelor of Nursing Study Program to turn on the camera and use the virtual background provide the comment. Fourth, each participant must wear neat or formal clothes. If during the event, all participants who follow to the Zoom are expected to activate the camera. The sixth, participants are requested not to leave the Zoom before the activity is over. I repeat again. First, each participant must follow the activity from beginning to the end and fill in the initial and final attendance. Second, format the Zoom name is into the class _absent_name. If it does not match the format, participants are not allowed to enter the Zoom. Third, it is suggested to the International Just Lecture participant of the Bachelor of Nursing Study Program to turn on the camera and use the virtual background provided by the comment. Fourth, each participant must wear neat or formal clothes. Fifth, during the event, all participants who follow through the Zoom are expected to activate the camera. And the last, participants are requested to not leave the Zoom before the activity is over. Assalamualaikum warahmatullahi wabarakatuh. Good morning to all of the participants. Welcome to the International Just Lecture of Nursing Study Program Malang. The Honorable Speaker, Dr. Zamzalia Abdul Mulud, the Honorable Head of Nursing Department. We respect Head of the Bachelor of Nursing Study Program and Head of the Nursing Profession Study Program. We respect Nursing Department of Sub-Coordinator. We respect to all lecturer of Health Polytechnic of Malang. Welcome to all students of Bachelor of Nursing Study Program and Profession Study Program at Zoom and YouTube, and our guest student from Central. Praises and gratitude let us present of the Almighty God, who has bestowed grace and guidance, so that today we can attending in the International Just Lecture of Nursing Malang, with the namely the implementation of interprofessional education and interprofessional collaboration in clinical setting in the best condition. First of all, let me introduce myself. My name is Iriwe Faiki, as a Master of Ceremony, who will be guide today's activities. The schedule of today's event, that is, for the first, opening. Second, praying. Third, singing the national anthem and the hymn of Health Polytechnic of Malang. Fourth, speech from the head of the nursing department. Fifth, delivery of material, the implementation of interprofessional education and interprofessional collaboration in clinical setting. Sixth, discussion session. Seven, photo session, and the last, closing. Before starting today's event, let's pray that it will be led Islamically. For those other religion, please adjust. To Nazilatul Khairah, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Shalom, Om Swastiastu, Namo Buddhaya, salam kebajikan rahayu. Hadirin yang berbahagia, marilah kita buka acara kuliah tamu internasional Prodi Sarjana Terapan Keperawatan Malang pada hari ini dengan berdoa dan bermunajat agar acara dapat berjalan dengan lancar. Izinkan saya memimpin doa dengan cara Islam. Ibu bapak hadirin sekalian, mohon berkenan untuk menyesuaikan sesuai dengan keyakinan masing-masing. Ya Allah, ya Tuhan kami, pada hari ini kami akan melaksanakan kuliah tamu dengan memohon ridho dan izin-Mu. Berkahilah langkah dan perbuatan kami, dan jadikanlah pelaksanaan acara ini sebagai ibadah kami dan berilah ilmu yang bermanfaat bagi kami. A'udzu billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Hamdan syakirin, hamdan na'imin, hamdan yu'afini amahu wa yukafi mazida. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhika wa 'azimi sultanik. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Wa sallallahu ala Muhammadin wa ala alihi wa ashabi ajma'in. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin. Walhamdulillahi rabbil alamin. Al-Fatihah. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you. The next agenda is singing the national anthem and continue with the hymn of Health Polytechnic of Malang. For the participant, please be seated uprightly. Thank you. The next agenda is welcome speech. Speech will be delivered by the head of nursing department to Mr. Imam Subekti, SKP MKOP SPK. Time is yours.
Thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salatu wassalamu ala asrofil anbiya'i wal mursalin Sayyidina Muhammadin wa ala alihi washabihi wasallam. Ladies and gentlemen, the head of Bachelor of Applied of Nursing Program Studi at the Head Polytechnic Ministry of Health Malang, or Poltekkes Kemenkes Malang, and especially the Honorable Mrs. Dr. Samzalisa Abdul Mulud from Nursing Science University Technology of Mara, Malaysia. Thanks for your coming. Let us thank Allah Subhanahu wa Ta'ala for His mercy and blessing and us all. Alhamdulillahirabbil alamin. Today we were able to attend an international guest lecture led by a Bachelor of Applied Nursing Program Studi in Poltekkes Kemenkes Malang with the theme Implementation Interprofessional Education and Interprofessional Collaboration. We hope that the theme is this lecture can increase to our understanding for nursing student in collaboration with other disciplines. This is very important because when you become the nurse, you must able to collaborate with other colleagues in health services. I would like to thank Puan Dr. Samzalisa for your time to be present virtually to give the guest lecture to my students. Hopefully, the material given is this guest lecture can be useful for all of us. Amin ya rabbal alamin. That's all can I say. More or less, I apologize. And Assalamualaikum warahmatullahi wabarakatuh.
Thank you for welcome speech from Mr. Imam Subekti, SKP MKOP SPK, as a head of nursing department. Then enter the main event is the delivery of material with the theme, the implementation of interprofessional education and interprofessional collaboration in clinical setting by Dr. Zamzalia Abdul Mulud, who will be guided by the moderator in this guest lecture, Mr. Kisal. Before that, let me read the curriculum vitae from Mr. Kisal.
You can introduce.
Okay, let me read the curriculum vitae from Mr. Kisa. Mr. Kisa have a full name, Mr. Kisa Bahari, MK PhD NS, and then there is an institution from Politeknik Kesehatan Kemenkes Malang, and then there is a phone number and email, and then education for the first Academy of Nursing Malang, the second Bachelor of Nursing Science at Brawijaya University, the third Master of Nursing Science at University of Indonesia, And the last, Doctor of Philosophy in Nursing at SPUP, Philippines. And then there is a research focus. There is a mental health nursing, nursing technology, and nursing theory development. And then there is a Corpus, Orchid, and Google Scholar ID. Okay, right away to Mr. Kisabari, MK PhD&S. Time and place is yours.
Yeah. Thank you, Mas Rizky, for your nice introduction. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Okay, the Excellencies, the head of nursing department, Bapak Imam Subakti, the honorable head of Bachelor of Applied Science in Nursing and Nursing Profession Program Study, and of course, our distinguished speaker, Dr. Zamzaliza, and our participants to this event. I'm very honored today as a moderator in this event. Hopefully, we will have a lively discussion about the implementation of interprofessional education and interprofessional collaboration in clinical setting. Ladies and gentlemen, we have a wonderful lecturer today, Dr. Zamzaliza Abdul Muluk. She is a senior lecturer at University Teknologi Mara, Malaysia. Dr. Zamzaliza, now a senior lecturer. Her address, Center for Nursing Studies, Faculty of Health Sciences, UTM, Puncak Alam Campus. Her telephone number, you can see her education background, and 2022 postgraduate certificate wound care management and tissue availability, Royal College of Surgeons, Ireland. 2015 PhD, Medicine and Health Sciences, University College Cork, Ireland, also in mental health nursing, same with me. 2008 and Master of Nursing from Gerontological Nursing, Griffith University, Australia. 2003 Bachelor of Science in Nursing, Bachelor of Science with honors in nursing, University Malaysia, Sarawak. And 2000 he also from a diploma in nursing, University Science Malaysia. She has many professional experience. In the last from 2021, until now, visiting scholar and School of Nursing and Midwifery, University College, Cork, Ireland. And so many experience, and she also has so many publications. Next, 2022, 2021, and also many publications. Amazing. Okay. Next. So many publications from since 2033. 33. Yeah. And also she get a research grant. 2021, 2020, 2019, so many grant, and she also as a reviewer. Okay, I think it's our expert lecturer today. Okay, ladies and gentlemen, Today, Dr. Zamzaliza will deliver her topic in about 1 hour and then follow discussion session about 30 minutes. In the discussion session, you may raise your hand if you want to ask question, or you can write down the question in the chat box below under the format your name and your class and follow your question. During presentation session, please mute your microphone. I would like to say hello, Dr. Zamzaliza. Assalamualaikum.
Waalaikumsalam.
Ya, gimana kabarnya, Dokter?
Baik.
Alhamdulillah, ini bisa datang ini.
Yeah, thank you so much for the invitation. Thank you so much for the invitation.
Ya, Dokter.
Yeah.
Okay. You have 1 hour to deliver your presentation, and after that, discussion session for 13 minutes.
Okay.
Okay. Are you ready, Doctor?
Yes,
Okay.
I'm ready.
Now time is yours.
Okay. Assalamualaikum warahmatullahi wabarakatuh, and a very good mornings, everyone. So first of all, I would like to thanks to the Polytechnic Kesehatan Malang for inviting me for this session. So I hope that we can share our experiences, we can share, and then we can make discussion along the ways of these presentations. Yeah. So first of all, allow me to share my slide first. Can you see the slide? Can everyone see my slide?
Yes, ma'am.
Okay. Okay. So the topics, hold on, I need to make it. Okay. So the topic given to me today is the implementation of interprofessional education and interprofessional collaboration in clinical setting. And for me, this is a very good topic, especially we are nurses, and then the student one day you will become a nurse. So we need to work with other profession. We need to work together with other professions. And then we cannot work in silo. We cannot work individually as a nurse, because in hospitals, in rumah sakit, we have other professionals. So before I start, can anybody tell me, share with me, what other professionals groups, what other professionals, professions that nurses always work together in the hospital? Can anybody share with me? Give example. What other profession other than nurses?
Hey, Sujan, can you share your experience?
So those who are in senior years, you already went for your clinical placement. So what is the other profession that you work with in your clinical? Anybody want to answer, want to share?
Hello, anybody?
They're still thinking, maybe, Dr. Isa.
Yeah.
They're still thinking that
I want to choose Dr. Zamzaliza.
Okay, sure, no problem.
Okay. Mas Muhammad. Kirana, okay, Kirana. Yeah.
Maybe I think doctor.
Yeah. Doctor, okay.
Yes.
Yeah. Is there any other professions?
The formation
Okay.
and
What else?
Because the topic today is interprofessional education and collaboration. Okay, thank you so much for the answers. Okay, so as we know that we have many other professions that we need to work together in our clinical setting. For example, the main one, of course, the doctors, the physicians, the surgeons. the occupational therapist, radiographer. There's so many other peoples that we need to work with. So the topics today are related to how can we collaborate, how we can prepare the student to involve in the interprofessional education and collaboration. So, okay, so this is the history, history where the interprofessional education and interprofessional collaboration was introduced. The first information related to interprofessional was published in 1964, as you can see in this article. It said that it has been long accepted that no physician, able and however highly motivated, possess all the skills required. So no doctors, no physician, no nurses have all skills that required to provide service for population group. So we don't have all the skill, we don't have all the knowledge to treat the patients in the community, in the hospital. So these articles also mention that such services can only be provided by team. So this is the important keywords, teams. So as you have learned maybe in your first year in your perawatan, kursus perawatan, so you learn about the teamwork. So the important keyword is teamwork. Teams consist of, that's why I asked you before this, what are the other professionals that nurses always works together in the clinical setting, such as the physician, the dentist, pharmacist, nurse, physiotherapist, occupational therapist, social workers, clinical psychologists, and others. So these are the common themes that we work together in a clinical setting. So this is important because of, according to WHO 2010, there is no longer enough for health workers to become professionals. As we learn, semasa kita belajar mengenai nursing, the history of nursing, we are struggle to be recognized as a profession, as a professional, not as a job, as just to doing normal tasks. So we want to become professional. But according to WHO, professional is not enough. What we want now is to be interprofessional, because of, as we know that during COVID, we need to work together with all the healthcare team members to contain all the infections and so on. So now WHO said that we cannot work individually, we cannot work in silo. So we need to work interprofessional with other profession. But how? How can we work with other professions? Okay, so what we know now about the interprofessional practice and education. This is the current problem. And so I'm talking about what happened in Malaysia, in my country, but I'm sure that it's happened everywhere, including in Indonesia. So are we preparing the student enough to practice the interprofessional collaboration? So because of, as you can see, our faculty nowadays, for example, how many faculties do you have in your polytechnic? May I know how many faculties do you have, or how many of schools do you have?
4 departments.
Oh, departments?
Yes.
How many departments?
Nursing department.
Okay.
Nutrition.
Nutrition.
Midwifery.
Midwifery.
Yeah, and health applied. Health applied is public health promotion, medical record, and
okay, medical record.
Yeah.
Okay, so there's quite numbers of departments. So for example, in UITM, in University Technology Mara, we have the nursing department. School of Nursing is under Faculty of Health Sciences. Under Faculty of Health Sciences, we have 8 departments, including radiographer, medical lab, physiotherapist, occupational therapist, dietetics, and so on. So, but we are isolated from other health and medical faculty. And for example, we are isolated from Faculty of Medicine. We are isolated from Faculty of Pharmacy because they have their own faculty. Medical have their own faculty, health sciences have their own faculty, pharmacy has their own faculty. So there's no opportunities for the student to work together, to do any activities, academic activities together because they are isolated. Because of, for example, in my universities, they are quite far between one faculty to another faculty. Okay, and then student tourist rotation. This means that student, you just do the rotation just to focus on our area, nursing areas, without we try to learn of other profession. And then siloed accreditation. Of course, if you want to apply for accreditation, I'm sure the programs in Polytechnic Kesihatan Malang, they have all accredited. But we only accredited the individuals programs. We not accredited as a whole. As a whole. So it makes the interprofessionals education and collaboration is quite difficult because of we are quite separated from each other, starting from education. Okay, and then focus on individuals, clinicals, and competence. So for example, for midwifery, for nurses, we will focus on what clinical competency that we need and what clinical skills that we need. For example, we learn about the what are the normal value for example, the blood, cholesterol, and so on. But we just focus on the normal value and then to identify what type of management that we can do. But we not focus on who will take the blood. So what are the other professions that involve in analyzing the blood? What are they doing with the bloods and so on? So we are too focused on the clinical competence individually for individual professions. Similarly, for other programs, for other professions, they are just focused on their own clinical competency. But you need to remember, when we are in the clinical setting, we are in the hospitals, we are in the clinic, we need to work together, but we don't have any ideas what other professions are doing, what their skills, what are their competency, and so on. We have no ideas. Because why? Because we already isolated from the beginning. We have isolated faculty, we have isolated departments, we have isolated programs, skills, and so on. Learning in silos, learning as individual, we did not involve other profession. I'm not sure about, maybe after this, we can share what have been implemented in Polytechnic Kesihatan Malang, and then what have been implemented in UITM, so that we can learn from each other. So basically in UITM, we have we try to implement the IPE. We try to invite the doctors. For example, we try to invite the dietitian when the student want to learn about nutrition and dietetics. For example, we invite dietitians. But it's only happen in class. So other than that, I think it's a long way to go for the IPE to be implemented in UITM. But maybe in Polytechnic Kesihatan Malang, you already advanced about that. Maybe we can share that experience after this. Okay, and then another problems that we can identify that makes IPE is necessary is we focus on care, not health. We just focus on how to treat the patient, how to treat stroke, for example, and not how to prevent stroke. And we focus on the disease-centered models, the disease-centered model and medical model. So we not focus on how to prevent the illness, how to prevent the disease before it's happened. Fee for service model, we more interested on the identify to make money, to make benefits, and then hierarchical care delivery. This is the most important barriers also for interprofessional education and collaboration. So in our healthcare system, who is the highest hierarchy? Who sit on the highest ranking? Maybe anybody can share what your opinion. Who will be in the highest position in the hospital and so on? You have observed, right? During your clinical setting. Who will be on top of the management? The doctors, right? Yeah.
Yes.
Yeah. The doctors commonly is everywhere. The doctors will be in the highest ranking and highest positions of the care. And then any decision related to care, related to patient care, is must come from the doctors. And the doctors is the main say in the patient's care. Okay, and then focus on individual patients and coordinated care, because of sometimes we have so many professions, they are not communicate with each other, so the care become uncoordinated. Okay, so these are the problems related to the fragmentations of care. So the isolation of care, we need to work together. Actually, we need to work together, but because of we have individual, we have different profession, so we work individually. Okay, so next is definition, and so maybe we can recall. What is profession? What is professionals and what is disciplinary? What are the differences and what are the similarities? Okay, so professional is under the same general governing association. For example, our profession is nurse, jururawat, nurse. But under nursing profession, we have many disciplines. So can be specialty within an identified profession. So ada midwifery, we have mental health nurses, we have pediatric nurses, and then we have geriatric nurses. So discipline can be under the professions. Okay, so uniprofessional, the practice spectrum in the hospital, as you can see that we have first is uniprofessional, nurse. Nurse is uniprofessional. We have only one profession. Doctors, dietetics, radiation therapies, occupational therapies. So it's uni means one. If it's more than one, for example, in a ward, commonly we will work multi-professionals. So for one patient, they have one nurse, and then it has doctors, and then maybe it involves the radiation therapists who took their x-ray and so on. But their works they have multi-professionals, but their works individually. But for interprofessionals, all the professions in multi-professional, they works together, meaning that they makes discussion to decide whatever management, whatever care that best for the patient. And then another one is transprofessional. Transprofessional is maybe nursing, they can do the take blood, they can do the blood test, is across other profession, but we are more interested in interprofessional. How all the professions, how all the professionals, healthcare team can work together and decide what are the important and then what are the best treatment that we can give to the patient. Okay, so these are also the differences between interprofessional and multi-professional. Shared experiences, yes, both will share their experiences. But in interprofessional, we expect them to make a joint decision making. So this is something that we rarely see in our hospital. I'm sure that in maybe in Indonesia is different, but in Malaysia, there's no really that the doctors will make the joint decision making. So for example, doctor want to decide on what type of treatment best for the patient with hip fracture, for example. So they will decide based on their experiences. So for the interprofessional, commonly, if they want to decide on something, they will call for a grand ward round, for example, and then they will ask about what do you think about this? What do you think about the best treatment that we can give to the patients? So that's interprofessional, where the decision is made by all the professionals that involved in patient care. So interprofessional also shared responsibility and accountability for that decision. So all are responsible, not all the doctors only or the surgeons only that responsible. In interprofessional, the decision, because it has been made joint decision making, so all members of the teams shared the responsibility and accountability for that decision. Okay, this is the example. As you can see in the picture, is the example of the interprofessionals team members. So this is actually based on the definition by World Health Organization that interprofessional education occurs when two or more professionals learn about, from, and with each other to enable effective collaboration and improve health outcome. So actually the purpose and the aim of interprofessional education and collaboration is to improve health outcome. And not to make the students' life miserable because you need to learn about other profession. But the main aim is we want to the patients improve in their health outcomes. Okay, and then it occurs when there is interaction between student and faculty members of different professions. Okay, after this, I want you to think about what are the activities in your polytechnic that you think involve all other professions and students from other profession, because of, as Dr. Kisa has mentioned before this, you have many departments. Can you think about any activities that you have interaction with other profession, student from other profession? Maybe in curricular activities, you have extracurricular activities, or maybe if you have any seminar or any workshop that involves students from other profession, so it can call interprofessional education. Of course, there's a lot of other activities that can be done to be considered as interprofessional education. So what are the goals? Kenapa kita mau interprofessional education ni? We need to improve our profession. We need to make sure our profession is visible. People know that nurses exist. Tapi kenapa kita masih nak perlukan interprofessional education? Okay, so performance of skill required for collaborative patient and client-centered teamwork. As I mentioned before, there's no one healthcare members that have all the skills required. So we need to share our skills. We need to like complement each other in the clinical setting. But the most important part is understanding and respect for the role and unique contribution of the health professionals. So nursing is very unique, as you can reflect that we also can do cover about nutrition, right? We give education to the patient related to the nutrition, even though we have nutritionists. And then we also can give information related to medication, even though we have pharmacies. So now we can see that nurses, they can, their areas covered every other areas of other profession. So this is very important that you need to learn, and then you need to learn and respect other people's professions and their skill. So because of sometimes students or the nurses, even experienced nurses, they are sometimes they got confused about the boundaries, the limit of their what they can do and what they cannot do. So for example, if patients in the ICU, in the ICU, nurses in the ICU, they commonly perform the percussion, chest percussion to remove the phlegm, to remove the, to make before the suction, suctioning procedure. So, but it's actually physiotherapist is the most important or the most correct profession to do that. But because of nurses, we have covered a lot of other skills, because that's the nature of our profession. So I think it is important for us to really understand and then the boundaries, what we can do, and then what that's the other people's, other professions skills. Okay. So this one is a reflection about the fragmentation. It said that if healthcare providers are expected to work together and share expertise in a team environment, it makes sense that their education and training should prepare them for this type of work arrangement. But unfortunately, we educate our students, I'm sorry to say it, is including in UiTM, in Malaysia, we educate our students individually, separately. For example, the hospital nurses, they have their own faculty, physio have their own faculty, lab sciences, paramedics and medicine. But in reality, we actually need to work together in the hospital, but we train them separately. So it's quite difficult actually to change the mindset to make sure that we are all can educate the students together. Okay, so and then the definition of interprofessional collaboration. Before this is interprofessional education, but this one is interprofessional collaboration. When multiple healthcare workers from different professional backgrounds works together with patients, families, carers, and communities to deliver the highest quality of care. So before that is about education. Now interprofessional collaboration, it reference more on works in the hospital, work in the clinical settings. Maybe you will say that, oh, of course we work together with other teams. But are you doing the decision? Are you making the decision based on the discussion with all members of professional team? I'm sure there's a lot of lacking there. We are not making decision based on the collective decision, but we make decision based on our individual professions. Okay, and then healthcare activities which require collaborative interdependent use of shared expertise directed toward unified purpose, delivering optimal healthcare. For example, this one, interprofessional collaboration is consists of all teams professional that involved in care of the patients. Okay, so why do you think interprofessional education and collaboration is important? Because nowadays we have shortage of healthcare workers worldwide. For example, we short about 4.3 million healthcare workers, especially during the pandemic. You can see it's happened everywhere. Shortage happen everywhere. In Malaysia, for example, to the extent we need to call back all the nurses, all the healthcare workers that already retired. We offered them contract-based job to cover the shortage of nurses and other healthcare workers during the pandemic. You imagine nurses in their 60s, 70s years old, they need to come back to the healthcare system to cover the shortage due to the unexpected pandemics. I'm sure it's also happened in Indonesia. So maybe before pandemics, the what we call the view is not so obvious. The impact of shortage, but during pandemic we can see the impact of shortage. How patient just lay down in the on the floor in the emergency department without any treatment because nobody there. If there's any nurses left, they are need to be quarantined because they are exposed or they're contracted with the COVID-19 and so on. So it's horrible what's happened in these 2-3 years, but we have learned a lot from this pandemic. We have learned that interprofessional collaboration and education is very important in terms of managing patient during that situation. Okay, so this was listed by WHO in their framework for interprofessional education, published in 2010. The WHO have seen that interprofessional education is very important. So there we need to have a clear roles and responsibilities. So everybody, they need to understand their own roles and then their own responsibilities. And then the ethical practice, because we need to involve on the making decision on patient care. So we need to make sure there's no ethical issues involved in whatever decision that we have. For example, you said that, oh, I want to do the interprofessional collaboration. So I will take the informed consent because of I work together with the doctors. I will take the informed consent from the patient before the surgery. So that's not allowed. So that's not allowed. It's not only unethical practice. It will considered as a law. It's involved law. You can be charged with negligence and so on. And then the conflict resolutions, because of course, if you want to make decisions together, there will be one professions that think they are higher from the others. So they sometimes they don't have any, they don't want to hear anything from other profession because they think that their decisions are the best because they are above other profession. So that's why communication and collaboration and teamwork are very important. Important to be inculcated in the students from the students' life. So communication is very important. So we can reflect back when we are working, when you are working in the hospital, in the ward, how healthcare professional healthcare profession, they communicate with each other. I'm sure that many forms of communication is in a written form, and we write a report. And then sometimes doctors that they didn't bother to read your reports. So actually the communication for interprofessional collaboration is like we do the grand round, grand ward round. And grand round is a very good opportunity for the interprofessional collaborations to happen. During grand ward round, commonly if the doctors they want to apply the interprofessional education and collaboration, they will ask all the team members. For example, in certain hospital in Malaysia, during the grand ward round, there will be the specialists, the houseman, the medical officers, nurses, and then they will call for pharmacists to give opinion about medication. And then if the patient involve physiotherapist, they will call the physiotherapist to follow the grand ward round. So from this practice, nurses and other healthcare professionals, they can learn from each other. So before this, it's only 10 years back, I think the pharmacist has been called to follow the grand ward round. Before this, the practice is just the specialists, the doctors, and nurses. Nurses just, they don't have many voices to voice their recommendation, suggestion, and so on. They just follow the doctor's orders. But it needs to be changed for educational, interprofessional, and collaboration. To implement it, it has to be changed. So these are the benefits of IPC. It's improved communication. The doctors want to make decision, they need to ask the pharmacist. They need to ask the suggestions from physiotherapists, from radiographers, from nurses. So it's indirectly will improve communication between professions. Increase efficiency, because of we know what we need to do, and then we know what other people need to do. Improve employee morale, because of, for example, for nurses, they now know that their voice has been heard. The suggestion, the doctors want to know about their suggestion, their recommendation. So it will boost their morale and motivation. And then foster creativity and better problem solving. Is not because of some people say that two head is better than one. Have you heard about that? Two head is better than one, especially in problem solving exercise. So if we discuss it, we will come up with a better solution. Networking, better clinical outcomes, cost effective, and strengthen professional identity. So we are in an era in the decades that we don't want to be considered, we don't want to be accepted as a doctor's assistant anymore. We need to improve. We need to make sure that our nurses, our nursing is visible and have the professional identity. We want to be considered as professional. So works together, not works to the doctors. You work together with the doctors. We work together with other healthcare professional. Okay, so these are the evidence based on the previous research. They found out there's many positive outcome of interprofessional collaboration compared to uni-professional collaboration. And so, like I mentioned before, that patient will report higher level of satisfaction, for example, improve healthcare, and then by collaborative team, because of sometimes nowadays patient they are very knowledgeable. They want to know more about what happened to their health and what they need to do, what lifestyle changes that they need to do. So giving only one source of information, for example, from the doctors, there's a lot of other things that we can't cover. And doctors sometimes they have a limitation, for example, to teach about the self-care management because that's a nurse's area, or to teach about the medication because that's pharmacist area. So if we implement the interprofessional collaboration, all members can provide the important information and the important care to the patients. Okay, and then there's other also based on the study finding, the research finding, improve and assess and coordination of healthcare services, appropriate use of specialist clinical resources. So these are also another problem that our healthcare system in these countries are facing, because sometimes patients, they don't want to go to the clinic first. They want to go straight away to the specialist, even though their disease are only minimal, only it's not a chronic, just not as severe as other diseases. But of course, especially we can provide the specialist resources for the most required patient that required it most. So if we coordinated our services, we discuss with each other, we can implement, we can make the coordination of the delivery of the healthcare services. Health outcome for people with chronic diseases, patients' care and safety. Chronic diseases for especially for nowadays, as you know, that non-communicable disease, NCD, they are the most important and the most commonly occurred diseases in this millennium. So managing chronic diseases is very important, and then team multidisciplinary interprofessional collaboration is help to manage their diseases. Okay, and then these are other research that found that the collaborative practice can decrease patient total complication, length of hospital stays, tension and conflict among caregivers, staff turnovers, hospital admission, clinical errors rate, and mortality rate. So as you can see, there's a lot of positive outcome of implementing interprofessional education. Okay, so what are the principles of IPC? And what are the principles? What are the things that need to take into consideration before we implement the IPC, interprofessional collaboration? So it is patient and family centered. It's not the healthcare system centered, not nurses centered. It must be family and patient centered. Community and population oriented, because of, as I mentioned before, nowadays there rise of non-communicable disease. So we need to make sure that the promotion, health promotion, disease prevention targeted on the population and the community. So our focus now shifted from taking care, managing patient in the hospital, to preventing diseases in the community. Okay, and then relationship focus. So we need to, in order to implement IPC, so we need to ensure that we focus on the outcome of our relationship with other professions. Process-oriented but outcome-driven. Okay, integrated across the learning continuum. So make sure that it's not the interprofessional education, for example, it's not supposed to be limited to the classroom or lectures only. So we can implement the IPC, IPE outside the classroom. For example, during co-curriculum activities, we involve all other students from other profession, so that the communication occurs during that activities. So the student from perawatan, for example, they will ask the student from gizi, dietitians. Dietitian, they will, what are you doing in the hospital? What is your role in the hospital? So the communication occurs during the activities that make the student learn from each others. So it's also applicable across the professions. And then next is sensitive to systems contact, meaning that it must be followed whatever healthcare system that you have, because we have various healthcare system. It must be applicable. If you want to apply, if you want to perform interprofessional collaboration, it must depend on the healthcare system, what type of healthcare system delivery that you are in. Okay, of course, if you want to implement something, it will come with barriers. Barriers. We know that from the previous slide, we know that the IPC, IPE is very good. It improve patient outcome, decrease length of stay, decrease mortality, but there's some barriers that maybe the departments, the polytechnic, that if you want to implement it, you need to take it into considerations. For example, standardization of learning content levels. So for example, you want to do the course that involve all students from other professions. So you need to standardize the content to make sure all students that get the similar content, different levels of knowledge, because of those who are taking midwifery, that will their focus of their knowledge is different from those who are from perawatan. For example, harmonization, this one is based on the medical and nursing slide. Chronological harmonization, medical and nursing curricula. Organization of IPE, so personal resources, do we have enough resources from every professional? For example, you want to do a combined lectures between the medical student and nursing student. How about the resources? Who want to teach? Is nursing staff, nursing lecturers, or medical lecturers? Do you have enough staff to do that? So that's the question that you need to ask about before you implement the interprofessional education. And then time resources and financial resources. Of course, if you want to implement something new, it will come with extra cost. Okay, so this one is actually based on research by Homeyer in 2018. They also found that the barriers is low mutual respect between medical and nursing students, and resulting limited willingness for IPE. Of course, if you are a nursing student, we are so proud to tell other people that we are nursing student. But of course, there's no harm for us to be proud of our profession, but we need to have ability to show some respect, to other professions. We need to have a willingness to learn about what other people, other profession did in their daily works. Respect is very important if you want to implement interprofessional collaboration. Low appreciation of medical students toward nursing student. So this is, I think, it also happens everywhere. Because some of the students, not all the students, but some of the medical students, they think that they are above other professions as student, because everybody's want to become a doctors, right? And then not easy to get place to become a doctor, medical student. So they will ask the lecturers, why I need to know about what nurses do, and why it is important to know about what nurses skill, what skills of nurses has. So that's also the barriers for implementation of IPE based on the research by Homeyer. Legal issues related to the boundaries, what we can do, what we cannot do. If you do that, it's maybe illegal. Okay, so even though we have various barriers various barriers to implement interprofessional education, but we need to change. So as you can see that there's a paradigm shift for our healthcare system compared to 50 years ago. So there's a changes in our healthcare system. For example, the physician-centered practice to now patient-centered practice. So now patient, if 20 years ago, if you work 20 years ago, 30 years ago, patient, they just follow whatever the doctor's orders. But nowadays, they have their own opinion. Even though the opinion come from Google kan, from TikTok ke. So they have their own opinion. So now we need to listen more to the patient. Practitioner autonomy to team collaboration. So from the doctors that make their decision, so it's for team collaboration. Focus on illness and cure to focus on health promotion. We don't want many patients to be admitted to the hospital. So we need to focus to prevent the diseases from happen. Passive patients role to involve with patients and family. So that, as I mentioned before, patients nowadays, they are very knowledgeable and they have so many knowledge, even though the knowledge is sometimes is cannot be accepted because they only knows from other resources, unreliable resources. But now we focus on patients and family. Acute episode care to care for chronic condition. So the interprofessional collaboration, they need to shift from the old practices to the new type of practices. So the changes happen in inevitable. We cannot prevent it from happen. So of course, change is hard. So as we need to change from work in silo. Nowadays, if you learn about interprofessional collaboration, you need to work, you need to make decision, you need to make discussion with other team members before you come up with best decision and best management to the patient. Okay, so what we can learn from this cartoon lah. When asked, would you rather work for change or just complain? So the findings, 60% of the respondents replied, do I have to pick? This is hard. So even though the question is about complaint, the answer is also complain. And so many barriers for the implementation, for if you want to change some things. Okay, so these are the factors. I think these are all already covered in the previous slide. Okay, so how? Now we come out with how we can implement. How, for example, the Polytechnic, Kesihatan Malang want to implement IPE. Or maybe you have implemented it. Maybe you can share your experience with me. Because of it's good for us to learn from each other to find what are the best practices. Okay, student and faculty represent multiple health professionals. So as Dr. Kisa mentioned before, your Polytechnic has consisted many departments. So you can do the IPE because of you have many departments and then many professions. Objective include demonstrating a level of achievement related to interprofessional competencies. Okay, Simon, for example, you have created one course that needs to be taken by all students. Doesn't matter, it's come from whatever professions. So that's the thing, one thing that your departments can do to introduce IPE learning experience. Okay, types of IPE programs. So IPE day or workshop involve all the not only nurses or student from perawatan or student from midwifery. They only do their own workshop. Try to involve and try to collaborate with other profession. IPE seminar, for example, you want to do the seminar related to wound care, for example. So during that seminar, you call the nurses, wound care nurse, and then you call also the dietitian to talk about what type of foods to help with the wound care. And then you call also pharmacists to talk about the medication. And so that's how IPE can be implemented. Not all the participants or not all the speakers are from nursing. For example, you call from other departments too. IPE clinical experience, even though sometimes it's so difficult to do the grand walk round with the doctors, maybe what we can implement it is to do the walk round with students from multiple professions. Nursing student, pharmacy student, student from dietitian, dietetic. We do the walk round together, look at the case, and then try to discuss the management from different perspective. Nursing will talk about the nursing care, and then pharmacists, they will talk about what type of medication. So that's, I think, the good practice. We try to involve all students from other profession in our round, not limited to nursing students only. Okay, IPE didactic courses, maybe you created one courses, IPE embedded throughout the program. Maybe you have already have the programs or the courses that talk about IPE. Okay, so these are this one. Okay, so this is the example of IPE implementation from a research by Arvin in 2050. What they did was the IPE simulation, and they call it long-term care dining. So the simulation occurs in the dining areas of a nursing home. And you can see that they are all students, actually. They play a role as a geriatric patient in the home service. Okay, aims understanding orders of modified texture of food and fluid, who involve dietetic student and nursing student and occupational therapy student. So commonly in our nursing program, if we want to do the simulation, we will do among the nursing student. But now to implement the IPE, you involve students from other professions as well. Students played a role of nursing home residents, family, and staff during a dining room simulation based on 4 case studies. Dietetic student prepared the meal, and students who are randomly assigned to a meal was one of the following texture: regular, soft, mince, and pureed. So because of different type of food, they need different type of utensil. They need different type of skill on how to feed them. In addition to modified food, students experience assisted feeding, adapted feeding utensil, and clothing protectors, wearing bibs, while also stimulating vision and hearing impairment, tremors, and mobility changes. And so these are the simulation. Maybe you can try to implement it in your settings. So each interprofessional group attempted to solve problems, such as when we do the simulation, we try to give them problem. For example, patient have tremor. How the occupational therapy student try to solve it. How nursing student try to solve it. And then how dietetic student try to prepare food that's suitable for this one. So each student, even though they are manage the same patient, but they have different set of skills needed to improve the patient's outcomes. Okay, after that simulation, they will call all the students for discussion, and then they will ask the student to reflect their opinion, their experiences. I think this is a good example. Maybe you can do another example that involve all the students, a patient who has stroke that require positioning, for example, patient with wounds, pressure ulcer wound, and that require dressing, that require health education from dietetics. So there's a lot of things that we can involve to implement the IPE. So this is another example that have been conducted in the Ohio State University. The IPE simulations leads by nurse practitioners and medical doctors. So in this picture, in this simulation, the nursing undergraduate and nurse practitioner student, medical student, pharmacy student, and a radiotherapy student. They're involved together. They make discussion about the patient care. So every student, they will come up with their own perspective based on their professions. So it's indirectly make us learn from each other. Other types of implementation that we can implement in our curriculum is core curriculum that involve all the students, the event, the student-led clinics, and global IPE learnings. Okay, so these are the things. Simulation, as we have learned before, conducted a symposium that involve all the professional courses, research, and don't do research among nurses. You need to invite all other profession. Okay, shared field experience and service link. These are the example of activities that can enhance the interprofessional education. Okay, so this is seminar teaching method. So this is example how we can do the grand walk round among interprofessional students only, lead by maybe the lecturers from nursing, lecturers from dietitian, and they will conduct a grand round. Okay, so maybe before I end my presentation, maybe I can share a little bit about the Malaysian perspective of IPE. So I think compared to other Western countries, we are quite far behind in relation to the IPE and IPC, interprofessional collaboration. So our healthcare is largely uniprofessional and its approach. Communication across specialties in healthcare relies heavily on appropriate written referral. There's no oral communication. There's no discussion. For example, doctors will write referral for this patient to go for physiotherapies. So it's actually good if the doctors can discuss together with physiotherapists what type of treatment that you think for this patient, best for this patient. But it's unfortunately the communication still occurs in written referral. Knowledge of other professions' role is limited to the bare minimum. So we don't have any ideas what are the occupational therapists' skills and what are the physiotherapists, their skill and competency. We don't have any information. Patients who need further care from health professionals are often referred by letters or phone call. Okay, and then although patients receive services of multiple health professionals, these services are essentially fragmented in their approach, reflecting a multidisciplinary model that contrasts with interprofessional models. So multidisciplinary is good, but it's quite fragmented because of different individuals, different professionals, they work individually. It's not in a team. Okay, university medical student mainly taught by medical doctors. Other health professionals have similar educational model. Nursing have been taught with nursing lecturers. Dietetic will be taught by dietetics lecturers. So exposure to healthcare professional is limited during training. If we want nurses, our nurses to implement interprofessional collaboration, we need to introduce it early during the education name. Okay, we also have the Malaysian Qualification Agencies. It is a higher education accreditation that supports teaching and multidisciplinary in higher education curriculum. So all universities, they must follow and fulfill the requirement by Malaysian Qualification Agencies to be qualified and to be accredited by MQA. So MQA has listed 11 learning outcome that need to be fulfilled by all students. All students in whatever courses, doesn't matter whatever courses that you take, you need to achieve these 11 learning outcome. So these are example learning outcome for nursing students. As you can see that here it has ability to adopt holistic approach management and patient management. If you said about holistic, it's involved working with other people. So listed by MQA, so it has some form of interprofessional education and collaboration. For example, number 3, the student must be able to work collaboratively within a multi-professional team with integrity and enthusiasm to assume problem when appropriate. So you see that in course learning outcome number 3, the student must be able to work within multi-professional. So we are moving forward for interprofessional education in this country. And then this is example of a module implemented by one of a public university in this country, in Malaysia. For example, it has a comprehensive healthcare module where all students from under the medical or faculty, it has many departments. So students from various departments, they need to enroll in this module, working together as healthcare team module and interprofessional problem-based learning. And so this is example, the exposure that we want to give to the student to work together with other profession before they entered the working profession. Okay, the student feedback from this module that they implemented. So the student give a very good feedback. For example, diabetes causes blurring of vision and other complications. It's amazing how different professions manage a patient. This was mentioned by audiology student. So this one, physiotherapy student mentioned that I assume a speech therapy only guide the students to speak correctly. Well, they assess the swallowing function and the dentition suggests the correct food intake for nasopharyngeal carcinoma patient. As you can see now, we can see the student can see different professions, they have different skills. Even though we don't have any idea or we have some perception about what different professions did. Okay, so this also they're satisfied with this one. Okay, so now I will end my presentation and then we need to keep the vision forefront. So what we need to do and the changes, the IPE, the IPC is all about improving the patient's care. So that's our main aims, main objective of implementing IPE or IPC. Okay, I think that's all. Thank you so much. And then I pass back to Dr. Kisa.
Thank you, Dr. Liza. Thank you once again for the insightful presentation. Now, time for discussion. You have some question. The first one from Diah Catur. Yeah, from Diah Catur Pitaloka. The question is, how is the management system of interprofessional education and interprofessional collaboration implementation in Malaysia?
Okay, thank you so much for the question. So I have shared about the Malaysian perspective. Unfortunately, we try for the past 10 years, we try to implement the interprofessional collaborations in our clinical setting. So what we have implemented for each profession, they have their own management. but the interprofessional collaboration occurs during the patient management if you reflect on the clinical setting. The ward round, the grand ward round, it involves many professions. It's not limited to the doctors, specialists, or nurses. So nowadays, the grand ward round involve doctors, specialists, nurses, dietitian, pharmacists. They are all involved in ward round. Even though previously we haven't done that. So that's how we try to implement the interprofessional collaboration. So during the ward round, what they did was they will discuss. One doctors will present about the patient's condition, and then the pharmacist, they will review the medication, and then they advise about whether this medication is appropriate for the patient. Nursing will advise, suggest about what are the nursing care needed for this patient. For example, maybe they said that about 2 hourly positioning and so on. And then the nutrition, if there's any family members here, they will give the educations. They will make sure that what type of feeding that appropriate, what type of food that appropriate to the patients. So I think, and then based on that information, doctors and then all the all the profession, they will come up with a best decision for that particular patient. And that's how we implement it. And similarly, I have an experience related to mental health nursing and Dr. Kisa, related to nursing. Commonly, there's patients who are aggressive. Aggressive. So if the aggressive behavior happen in the ward, commonly doctors, psychiatrists, they will call all the other professions that involve, including the cleaner. The cleaner in the ward also they will call. Because we want the patient, the healthcare professional, the healthcare team members know their roles and know their roles during if the aggressive behaviors happen in the ward. Yeah. So I think if I answer your question, dah ya. Dia catur ya.
Dia catur. Hello Dia. Dia.
Yes, ma'am. Thank you.
Okay.
Okay. Thank you. Next question from Bima, Mas Bima. Yeah. This question, what should we do if in a team there is a profession that does not carry out its duties, or does something that is not within its authority?
Okay, so profession nak carry the duty, something that okay. So that's why for the principle of IPE, IPC, interprofessional collaboration, the most important thing is we understand our roles and responsibilities, and we need to understand our boundaries. So sometimes it's so difficult to set what are the boundaries. And for example, in Malaysia setting, the most commonly confused boundaries sometimes is about who responsible to take the blood, to withdraw blood from the patient, for example. So in some hospital, what we learn in the education, in our training, nurses are not allowed to withdraw blood. But in hospital, in their implementation, nurses can withdraw blood. It doesn't matter because doctors don't want to come early in the morning to withdraw blood, because blood commonly in a ward, we will withdraw it early in the morning. And so they ask nurses. Of course, nurses, they can do that. But are we stepping the boundaries and the limit that set for us? So I think the most important thing in the IPC is to understand and respect for each other's skills. If not, it's not going to happen. We will go back to uniprofessional. We will treat the patients individually. So all professions, and they need to understand what they need to do, what they cannot do, and then try to learn from each other. So that's why it is important for the education that involve interprofessional activities. We start early from the training part. It's not we expect the student to be able to perform IPC when they are working, start in their workings areas. So I think that credibility is depend on that. I think all profession we have our governing bodies. So for Malaysia, for example, for Malaysian, we have a Malaysian Nursing Board. And so we have whatever skill that we rules and regulation that you need to follow. So if they're not carrying their duties, is considered maybe like negligence and so on, and then action can be taken to them lah. Yeah. So I hope that I answer your questions, Bima Ariyu.
Yeah, Mas Bima. Did you get the point? Bima? Bima? Hello, Bima.
Yes, ma'am, sir. Thank you for the answer.
Okay.
Yeah, okay.
You're welcome.
Good question from Ismi. Yeah. My question is, in the implementation of IPC in the hospital, will be the coordinator? Can the nurse be the coordinator in the IPC?
Sure, no problems. Nurses nowadays, they can become the head of hospitals. We have in private hospital in Malaysia, we have quite a number of hospital led by nurses. Nurses become the chief operating officer and CEO of the hospital. So we move forward from thinking that doctors are only professions. Can be the head of hospital. Now nurses also can head hospital. The coordinators, anybody can be coordinators, or if is in earlier part of the implementation, you don't need the coordinator too. And maybe it's just implemented during the grand ward rounds. If everybody's know their own responsibilities, there's no need for coordinators. But if there a requirement for a coordinator, why not? Nurses also can be the coordinators, because as I mentioned before, nurses, they covered all various areas of patient management. We involve in dietitian, we do the physiotherapy as well, we serve the medications, we do the nursing care, so we can do everything. So why not? You cannot become the coordinator. Of course, you can become the coordinator. Okay.
Ismi.
Okay, ma'am, it's already clear.
Yeah.
Thank you. Welcome.
Yeah, thank you. Next question from Clarissa. Yeah. Her question is, what is the important thing that must be strengthened at the beginning to develop interprofessional collaboration in the hospital environment?
Okay.
Because in Indonesia, IPC is still newly developed.
Okay, thank you so much. So I think before we ask about the IPC, the most important thing we need to start is from IPE, interprofessional education. So student need to be exposed with the interprofessional collaboration first before we can expect them to function as a members of interprofessional collaborators during their workings after they graduated from the school. So I think not in Indonesia, in Malaysia as well, in other Asian countries, what we need to strengthen first is about the curriculum, so the syllabus that focusing on the interprofessional education. Students should be involved with all the activities that involve, that collaborate with other profession, just to give it for exposure first, and then maybe you can create the curriculum, the syllabus, the course, like all the examples that I gave before, to expose the students so that they know their roles in the interprofessional environment. So the thing that I think that you need to strengthen is about education first. How to create the environment, education environment, that interprofessional education can be implemented. So after this, maybe you can implement the interprofessional program. Do you have any interprofessional activities, Dr. Kisa? Maybe if you can to.
Yes, ma'am. In community service,
Okay.
and also discuss about case, special case.
You involve all the profession.
Yes.
Okay, that's a good exposure. I think maybe it can be enhanced in future, so that many other profession can involve in that activities. So I think that's the good start for the IPC, IPE to be implemented. Okay.
Doctor, I have one question for you. In your nursing school, IPE is a spirited course of inserted in a specific course?
Oh, we don't have any specific course that name interprofessional education, but we have the extracurricular activities that involve all the students, and then we have the basic subject, for example, anatomy and physiology. So it involves all students from all departments. They will take the same subject. So they will go into the mass lecture in the classroom that have maybe 500 students, combining all the profession. So during that time, they will discuss about, for example, in physiotherapy, they will discuss about what is the most important part of anatomy related to physiotherapy, nursing as well, and the others. So as I mentioned before, we also try to introduce interprofessional school, but in the other universities, as I shared with you before, they already established the course that all students can take. But I think for the Polytechnic Kesihatan Malang, you have the social service, community service that involve all students. That's a good start. That's a good start, exposure to the students.
Yeah. Thank you, Dr. Liza. In Polytechnic Kesehatan Malang, inserted in specific subject or course.
You have the specific subject.
Yeah, like in management.
Oh, okay.
Like this one.
Yeah. So are you involved all the students from other professions, or you just involve nursing?
Maybe some topic only.
Okay.
Yeah.
Okay. So I think the purpose of IPE, actually we need to involve all students from other professions to take the same subject. Maybe the subject is not named interprofessional education. Maybe other subject, community services subject. That all students from all other departments take the same subject, so that they can discuss about different perspective from different professions.
Yeah.
Yeah.
Okay. Fahmi, you want to ask? Fahmi?
Yes.
Yeah, okay.
So, I would like to ask about the difficulty, or is there any problem or difficulty when doing the implementation of interpersonal education? Is there any problem? How we solve the problem? Thank you. Like miscommunication or something like that.
Okay,
Thank you.
thank you for the question, Fahmi. So of course, if you want to change something, that it will come with all the barrier. So like I mentioned before, the most important and the most common problem is about the respect of and communications. Because of based on research by Homeya that I mentioned before this, the student, for example, the medical student, they have a low respect to the nursing student. So I think in these things, what we can do is to expose them earlier. For example, it's not to wait until the medical student in their 4th year, the nursing student in their 3rd year. You need to start early. You need to start early. So for example, for ourselves in UITM, we also have actually 2 level of study. We have diploma in nursing, and then we have a degree, bachelor's degree in nursing. So in the first, when we offered the bachelor's degree of nursing, there have some miscommunications between the diploma student and the degree student, because the degree student, they have low respect with the diploma student because they said that they are lower level from them. So when we realize that issue, we start from early. So we ask them to work together. During their clinical placement, we pair the degree student with diploma student for them to learn from each other. So I think the most important thing that we can do is to expose student early. And then as a lecturers, we also need to teach the student not to differentiate or to have certain type of perspective to other professions, because each profession we have our own roles. So and then the exposure of the IPC, IPE need to be exposed early during their training and so on. I hope that I answer your questions, Fahmi?
Fahmi?
Yes, ma'am, I understand. Thank you.
Okay, thank
Yeah.
you.
Is there any question or no more? Maybe the last question. Remaining 5 minutes. Is there any question? No more? No more question, ma'am. Okay. No? No more? Okay. Enough? This session? Okay. We can close this session. All the participants, we have come to the end sessions. I would like to say thank you very much to Dr. Zamzaliza for sharing your knowledge to us, and especially to our students. Hopefully, we can see to other events. Maybe my student go to Malaysia, go to GTM. Maybe next time.
Sure, no problem.
So they get many experience.
Maybe I
Okay.
can come to Indonesia as well.
Yeah.
I went
Okay.
to University Brawijaya, I think last 2 years, before COVID. I attended the conference there, I think in 2018.
My campus near, maybe
Okay.
1 kilometer from Brawijaya.
Oh, not that far.
Not far. Yeah.
Okay. So thank you for inviting me, and then I wish all the best to all the students. May you have all the excellent results in your test and your exam, and then you will become an excellent and good nurses one day.
Amin, amin.
So I think thank you very much.
Okay, and thank you also for our participant for your active participate in this session. And hopefully this session you get beneficial for you and for your career, of course. Yeah. Okay, thank you very much. That's all. Assalamualaikum warahmatullahi wabarakatuh, and good morning. Okay. Time for Rifki, yeah.
Okay. We would like to say thank you to our moderator for guiding the international just lecture this time. Okay, for the next agenda is photo session. To all attendees are requested to turn on the camera. I repeat again, to all attendees are requested to turn on the camera. And now I will guide the photo session. Okay, let's start now. For the first slide, 1, 2, 3. Okay, the second slide, 1, 2, 3. Okay, the last slide, 1, 2, 3. Okay, thank you. Now we come to the end of today's event. To all attendees, thank you for participating in this international just lecture for beginning to the end. I am Review Paiki as the master of ceremony. Apologize if there are any wrong words, behavior that is not pleasing to all of you. For the last word, please always follow health protocols. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam.
Thank you, Dr. Zalia.
Terima kasih Pak Kisah, terima kasih
Ya, Pemer.
panitia
Bu,
biasa, terima
Bapak Ibu
kasih.
panitia semua sukses.